What's up, you guys? My name is Miguel, fellow Xray Tech here, giving you your daily dose of radiation. In today's video, we are covering the frequent flyers and trends I've noticed working here at the emergency room. So I am a night shift tech, been doing it for about 4 years, and believe it or not, if you were to just think the emergency room, it's when every once in a while someone's life, something unforgiving happens, they come in and it's a trauma, or it's an accident, or maybe everything else is closed, they started to feel sick at nighttime like most people do. This is the only spot, right? You would think that, you're like, Miguel, that doesn't happen a lot. Most people, maybe once a year, maybe a few times at most. There are people that show up every other day, multiple times during my 7-on. Sometimes I'll shoot them at night and then I'll come back and then I'm like, you're still here? You came back again? Like, there is... It amazes me working at this place. Certain people, they can't help it because they have conditions, they have problems, and it's fine. Other people, for anything, they'll come in and even the doctors will get frustrated. They'll be like, this is an emergency room. This is not an emergency. You could have scheduled this with your PCP. We're not an after. Like, you could see the doctors getting mad because certain people come in all the time and they're taking time. Certain stuff, they come in and you're like, okay, this is legit. Help them out. They're not doing too good. Other times, and it's kind of messed up to say, but they'll come in for any little thing, almost like they just want to be here. Or the doctor will fix them and they tell them, hey, you need to do this, you need to do that. And then it's like, oh, I'm feeling good. And then they forget or they just don't do what the doctor, and then they come right back. And you're like, bro, I'm over here doing the same exam on you. Didn't change, shooting you again just because you can't take care of yourself. It happens so many times. Like, if I recognize you and I know your name and I've shot you, there's people who are notorious that you just see them and you're like, you're back again, bro. I don't know. Sometimes I look at patients and I look at my life. I'm like, my life ain't that bad. I don't ever come to the emergency room like outside of work. How do people just manage to, they're just consistently in here? And I look at them, I'm like, is this what life awaits when you're older? Or when you is there not? I don't know. It's just astonishing. Or some people will get mad that we don't do a good job at the hospital, and then they keep on showing up over and over and over and the same thing. And then some of us are like, there's other hospitals you can go to if you're not pleased, but they just keep on showing up. All this to say is that you'll deal with people, even in the emergency room, which you would think only occasionally. You'll see them all the time. Certain people, I understand. There's certain people that you come in and you're like, yeah, you needed to come in. Other people, you're just like, you could have waited. You have the infamous, it's been hurting for 6 months, And here at 2 in the morning, I decided enough's enough. I had to come in. I'm bro. Even the doctor's like, what do you want me to do? Everything's closed. Even if some people don't understand, even if they discharge them or they send medicine home, all the pharmacies are closed. You can't get it till the morning. Once I figured that out, and I came with my kids sometimes, I'm like, sometimes I'm like, if it's not severe, I'd rather just come in the daytime and then my medicine can be there and they can feel better. But then I'm like, well, it's already daytime. I might as well just go to their PCP and take care of it. Unless it's something crazy and I know my PCP can't handle it. So anyways, it's been your boy Miguel. See you on the next one.